Kath is going to record this session. So you will get a copy of the recording sent to you, and you can share that with your colleagues and networks. For those who've been to one of our lunch and learn webinars before, about us, I'm Kate Lamont, OT and Director at Thrive, and I've also got Kath Kirby on RN and Co-Director at Thrive. Kath is entering the comments today, and you'll probably see her up on the screen. Hey, Kath. At Thrive Aged Care, our focus is on support people that work for older people. So whether you work health, aged care, in the community, aged care at home, it's about supporting you through education, through support, and we have a really focus on building skills in dementia support as well. So welcome to our Lunch and Learn. A little housekeeping before we start. We've got a jam-packed session, 30 minutes. So we do ask that you keep yourself on mute. It's just makes it easier to present. But if you have comments or if you have any questions as we go, please put them in the chat and we will that we get to them. At the end of the session, we'll turn off the recording, and if you've got other questions that you want to ask, we can do that as well. As we said, you'll get a copy of the presentation email to you, and you'll also get a link to the recording. So if you would like to share that with your colleagues, you can do so. And all our Lunch and Learn webinars are also up on our YouTube channel. So if you want to go back and watch some, they're there. They're freely available for you to watch and to share. So let's kick off today's session. So today's session is we're going to be talking about reablement. And we're going to be talking about what reablement really is. So we're going to touch on the links to the strengthened aged care standards. And we're going to have a think about how reablement really underpins Standard 3, care and services. And we will have some practical ways to think about how you can have a reablement approach in your day-to-day practice, whether you're in a care role, a clinical role, or a service role supporting older people in home or in residential aged care. So it's a big topic. We're probably just going to touch on the iceberg, the tip of the iceberg, but hopefully it gives you a lot of food for thought to continue thinking about reablement, what it is, and what you can do day to day. So let's start with a little bit of a scenario. We love starting our presentations like this. I want you to imagine that you have a new client in your service, whether you work in residential aged care or you work in home care. You have a new client in your service. His name is Jim. He's 89 years old and he's been struggling at home for some while. His mobility has reduced. He's had a few falls over the last few months and he's just really struggling with day-to-day tasks like making a snack. He's stopped showering because the thought of a shower makes him feel exhausted, and he's stopped going out because he feels like it's not really worth all the effort to get ready, to then go out and feeling exhausted. Because he's also not really eating much. So, and that's just because he's not feeling particularly hungry. So we have lots going on with Jim, okay? Now, Jim is a new client at your service, whether it's residential aged care or home care. But I want you to think, what changes would you expect to see in Jim after he starts receiving care and services from your organisation? Sorry, we've got someone on. If you could pop yourself on mute, that would be great. So what changes would we expect to see once Jim starts receiving your care and services? Pop your comments in the chat.
Microphone's on.
And I'd love to also hear why you think you're going to see those changes. So I can see some comments in the chat already. He looks a bit blank and lost. Yep, probably not looking like himself. But what would you expect to see once Jim comes into your residential aged care facility or once you start providing care and services in Jim's home? More engaged. Thank you, Jan. Yes, we'd hope to see that Jim becomes a little bit more engaged. Yeah. But yeah, perhaps he's lost his confidence. So maybe having support might increase his confidence. Yeah. You might see physical changes. Yeah, we've all said that he looks a little bit disheveled or he looks a little bit blank or lost. So we might see that that sparkle in his eyes returned. Oh, this is great. All the things. You guys, oh, now it's going fast. He's empowered, he's got support, so he might be able to attend to his hygiene, better appetite, his needs are met, he's feeling safe. I love that someone's mentioned maybe he's grieving the changes to his function and loss. Yeah. Socialization, he might feel like he belongs again. Yeah, really, really great. Weight gain, I love that. Really, really great comments, amazing answers. And why would we expect to see these changes? Yeah, we're seeing a lot of positive things. Why would we expect to see these changes? Yeah, because of the assessments that we're doing, the goals that we're setting with Jim, how we're supporting him at home or how we're supporting him in our residential aged care facility. Yeah, fantastic. Thank you. Thanks for those comments. So thinking about Jim, and that they're people that you're supporting every day, thinking about Jim in that scenario, it really is a good way for us to start to think about what is reablement, okay? Your comments with Jim were all about how with support, care and services, someone in Jim's situation might actually have a return to being able to do normal things in his life that are really important to him. Yeah. And that is a sense of reablement. So reablement at the moment is kind of a little bit of a buzzword, but it's not a new concept. It's been around for, a long time. And to really understand reablement, I'd suggest we start at the word able. Okay. So the word able means to have skill, to have cognitive and physical function, and to have the opportunity to do something. And that something might be whatever you want to do or whatever you need to do. So as adults, we are all able to do lots of things, aren't we? Yeah. Think about all the things we do every day, from getting up, getting out of bed, having a shower, brushing our teeth, cooking, eating, even just walking to the letterbox. It's an endless list of things that we are able to do every day, as are the older people that we are supporting. Yeah, they are able to do lots of things. Yeah. And they have been able probably to do more things than they might be able to currently do now. So the definition of being able is to have the skills, the intelligence, and the opportunity. Opportunity is really important to do something. Okay. Now, these can change when we have illness, disease, or age-related changes. Yeah. The skill can change, as can our function, our physical and our cognitive skills to do that. Opportunity is really interesting because we can sometimes lose the opportunity to do that. Yep, the environment can make us lose the opportunity. Yep. So when we think about reablement, it's about being able to do those things again. It might not even be to the same level or skill or independence, but it's to a level that is satisfying for the person, okay? There is a focus on returning to normal activities. Yep, so it's not about learning new things. It's about getting back to doing those things that you want to do or you need to do. Yep. And it really helps a person regain, maintain, or improve their independence or function. It's not just about gaining. It can just be about maintaining, because we all know that saying, if you don't use it, you'll lose it. And reablement is about that. Okay. It's about practicing small things every day that are linked to normal life. So why is there this buzzword at the moment? And it's all got to do with the New Aged Care Act and the Strengthened Aged Care Standards. Yeah, that came in the 1st of November, and we all know about that. But the Act and the standards apply for all aged care services now, residential aged care and home care. Okay. And the new Act and standards are rights-based, which is fantastic. It puts the person, the individual, at the centre of every care decision. Okay. And reablement is a really strong focus across the Act and the standards, across pretty much every single standard. And it really, reablement is a practical way that we can really give people rights, dignity, help them maintain independence, help them stay connected to their community, people that are important to them, help them to continue to make choices about how they want to live, and really help people to maximize their well-being and quality of life. Okay, so it's about receiving care and services that really supports you to live your life how you want, not limiting you to live your life how you want. Okay, and what's fantastic about this being built into the Aged Care Act is it's our legal obligation to provide care and services in this way. It's not something that's nice to do, it's a must do because of the new Aged Care Act and the strengthened aged care standards. Like I said, there's a reablement focus across all the standards, but I think standard 3 is really interesting because standard 3 is care and services, okay? And it's really all about how we provide care and services. So it's really about how we do everything in aged care, yeah? Whether we're supporting someone at home or in residential aged care, whether we're clinical, non-clinical, it's still how we do it. And we really need to have that reablement approach. So standard 3 outlines that we should work with people in a goal-based way, that our assessments and care plans reflect their goals, not just our goals, and that we provide care and services in a way that maintains or improves the person's function and gives them the opportunity to maintain independence, however that may look like for them. Okay, so it looks different for different people. The way we work is individualized. And we're working with the person's strengths and we're focusing on their goals and their abilities. And we're promoting patient at each and every opportunity. So the way we work, we're working with people, doing for people, okay? So like I said, this approach is not just for people providing clinical or care, it's for all aged care workers. So that includes non-clinical roles, people in support roles, anyone who has an interaction with a client should be working in a reablement way. So apart from meeting the standards, why does reablement matter? And we know that there's lots of great outcomes by taking a reablement approach for older people and teams and organisations who support older people. And it could be here all day talking about all these amazing outcomes, but we'll touch on them quickly. The first one is maintaining independence and preventing decline. And when we talk about decline, we talk about cognitive decline and mental decline. And I think I want you to keep in mind, if you don't use it, that's the easiest way to sum this up. Yep. If you're using your cognitive and physical and abilities, you're not going to be able to maintain cognitive skills and physical mobilities. Yep. And that is also the same for people with cognitive impairment. So reablement really builds confidence and capability for people to keep on doing the thing to them, whether it's showering, making a cup of tea, walking out into the garden, or just connecting with their community. The next thing that's really important is taking a reablement approach really helps to maintain identity, dignity, and purpose. Yep, and there's strong links to quality of life here. And we know that quality of life is also a strong focus of the Aged Care Act and standards. And I would say if you lack meaning and purpose in your life, or you feel like you've lost your identity, do you really have quality of life? Probably not, would be the answer there. The next thing that I want you to think about is, really the way that maintaining function and preventing decline has benefits for our clients. Yeah. So people who can maintain their function longer may have less clinical incidents, such as less falls, less pressure injuries, less instance of malnutrition, even changed behaviours. These are all linked and can be linked to functional decline. Yeah. So maintaining skills, cognitive skills, physical skills, is not only better for the person because it may minimise clinical incidents, but it's better for the team supporting that person and also the organisation. Seeing people do more, seeing your clients do more, seeing your clients participate in what's important to them is a fantastic reward. You're going to be seeing people who are happier and who have improved quality of life. And we know that that is why we go to work each day. Yeah, that's why we're in the roles that we're in. So the benefits for us supporting older people are great as well. Now, like I said, reablement isn't a new concept, okay? What it is, it's having a focus, a strengths-based focus. So it's thinking about what can the person do? Yeah, quite often in health and aged care, we think a lot about what the person can't do and what we need to do for them. So this is shifting our mindset to start to think, well, what skills and abilities does this person have? What motivates them and how can I tap into that? It's all about person-led goals. So it's not about our goals. It's about what's important to the person you're supporting. Yeah. And then how do we adapt how we work to try and help them achieve those goals that matter to them. It's not an all or nothing approach. So it's not like we're not going to go and help Mary in the shower because she wants to do it herself. It's about grading our support. Yeah. So that might start with just offering verbal support. So prompts for Mary to help her in the shower. It might mean that we incorporate some visual cues where we show Mary, the shower head. Or we might even move to a touch cue. So you can see there we're grading the support we're providing. Yeah. It still means that we're having a reablement approach. It's not an all or nothing approach. And it's about participating in daily tasks, meaningful activities that are meaningful for that person. So reablement is something that anyone, whether you're clinical care or non-clinical, can have this approach. Yeah, it's not therapy. So reablement is not a program. It's not therapy that's led by allied health. It can be part of that overall therapy, but it can be something that's completed by anyone as long as we're working collaborative and we're aware of the person's goals and how we're trying to support them to achieve that. It's doing with the person and it's not doing for. Yeah. That, like I said, that means that we can still provide support. Yeah. But we're doing it together in a partnership approach where the person also feels like they've got control and dignity and choice in whatever you're supporting them with. So reablement strategies, these are strategies that everyone in every role can incorporate every single day. Okay. And they're things that you might be already doing and you might not even know that you're doing them. Okay. But some really simple reablement strategies are the way that we communicate with people. Yeah. So we're communicating and supporting adults, aren't we? Yeah. And who here likes being told as an adult what to do? I've showered myself for 100 years and now you're telling me I've got to wash my toes when I probably don't wash my toes every day, to be honest with you. It's not how I shower. They're clean still, but I don't get down there and give them a good scrub. So it's about changing the way we communicate, encouraging rather than instructing. Okay. It's about offering choice. Again, we're adults. Yeah. About offering choice. And you might not agree with my choice. Yeah. But I'm an adult. And that's a whole other topic, dignity of risk. It's about helping to break the tasks up into steps. Yep. So here it's not that all or nothing approach. Well, Mary wants to shower as she wants to do as much as she can, so we'll just let her go. It's about supporting maybe that person to be able to do the task by making it a little bit smaller. Here, have you got your towel? Can you turn on the tap? Breaking the task up into steps. Another way of supporting someone to do with rather than for is the way that we provide cues. So like I said, you might just give verbal cues, helping, someone to get started or to move through a task. Visual prompts are really good where you might show the item. Hey, Kath, do you want a cup of tea? Or we might even give the person the item to help get the task going. So that's a bit more of a touch cue. Yeah. And you can see that we're grading that, putting more in for some people, taking some away for people who can do a little bit more themselves. Time is something that we are not very good at, health in aged care. And I think the world has changed completely anyway, that we're all so fast paced and we're so busy and we've got so much to do. Yeah. But giving a little bit of time to process might mean that that person can actually do more than you thought they could in an activity. Yeah. So it's kind of that thing, giving a little bit of time might actually save time in the end as well. Think about just slowing down your approach and your communication. The environment is really interesting and something we're going to go into lots of detail today. But I would just say have a look around. Yeah. Does the environment enable someone to do something, or is it actually stopping them from being able to do something? Yeah. So, I mean, an example might be, right? You've got someone who's in a wheelchair who wants to get up, wants to go to the kitchen to make themselves a cup of tea. Now, that person could probably do that task, except there's a flight of steps stopping them to get up to the kitchen. That is where the environment stops someone from doing something. Now, that's a really black and white example. But I think have a look where you work and start thinking, is the environment stopping my clients from actually doing things, limiting their participation and ability? So we've got some examples to talk through here, and some ways that you can think a little bit differently. Okay. So choice is one way that we can enable someone. Yep. So making sure that we're supporting choice and preferred routines and preferences. And, helping someone in the morning to get their day started is an example of that. Are we supporting them with what time they want to wake up and what they want to do when they get up? It might not mean shower first. Transfers and mobility. Anyone who's helping someone transfer from a bed or a chair, yes, we would read our notes and we would know roughly how much support they might need. Yeah. But we should also always be trying to include that person to use their skills in that transfer. Yeah. So, can you move your legs here for me? Can you put your hands here for me? And try to get the person to do as much as they can. And you might be surprised that when you give really good verbal cues and really good prompts, that they might be able to do more than you expect. Showering, this is a bit of an example, and we'll talk through this in a little bit more detail, but giving those step-by-step instructions, showing before doing. So those visual cues are really important. Yeah. Yeah. You want to wash your hair? Yeah. And giving time to respond. Always in personal care, I would say never always assume the person can do something before you jump in and you try to do it for them. Yeah, because you're in such a vulnerable personal task where the person, normally a small room, it's a private task. Always let the person show you how much they can do themselves before you step in to do. Okay. So there's some examples there. So here's just two different case scenario where someone's helping a person in the shower. Yeah. You've got a reablement approach and you're giving choice and time and breaking tasks down into steps. Then you've got the other case example. It's not particularly a reablement approach where it's a task focused approach. Come on, it's time for your shower. We really need to get moving. I'll do that for you. Okay. So the first approach uses encouragement and validation. It's often choice. Would you like to shower before breakfast? Would you like to hold the handheld shower or have it's breaking the task up into steps using visual cues that we've talked about and allowing in that extra time. And you see the environment, both have got rails and handheld showers, shower chairs. So the environment is supporting the person to participate as much as they can in that task. Okay. When we've got that reablement approach, the client is feeling more capable, more valued and safe. Yeah. We're maintaining not only and cognitive function, but also tapping into purpose and that sense of achievement, and that links to quality of life. So also in such a personal task, you're making it a positive experience for the person where they're doing as much as they can themselves, not like the second example here that has no reablement approach, where Mary is quickly ushered into the bathroom. Nothing's explained to her. The carer runs the water, starts undressing her without asking her, about what she wants or feels or seeing if she can do it herself. Does the entire shower for her, washes her hair, washes her body, washes her leg, doesn't really give Mary the opportunity to participate. It's a very different experience for Mary. Mary is passive in this. The task is done to her. She loses skill, she loses confidence, and perhaps it's not a very positive experience for Mary, and perhaps it's not one that she wants to do again. So we're really risking the client perhaps not wanting to engage in such a task again. Here are some photos of what it might look like. We've talked about grading your cues. The first one is me asking, would you like a shower or wash? So it's that verbal cueing. The second one is me showing the item and how to use it. So before I go and do to Mary, I'll let me wash your shoulder. Let's see if Mary can do it herself if she's looking at me. Wash your shoulder. Yeah. And the third is that tactile cue where, yes, okay, this hasn't been enough for Mary. She might actually need my help to get her started, but I'm got her hand on my hand and together we're going to wash her shoulder. Yeah. So we're doing it together, and that might be enough to prompt her. I can take that flannel and I can keep going. Yeah. So you can see how we're working together to get the task done, and we're having that reablement approach. Now, that's just one idea that we've talked about, how to support people with personal care, but there's lots of different ways we can have that reablement approach. And I think it's really important. I think mealtime's another really great time to think about a reablement approach. And here in the mealtime, the environment and the equipment that we use to support people is another thing to think about, how we give opportunities for reablement. So do we have the opportunity for people to serve themselves? Yeah, by using a buffet or by sitting down at the table and they have to pour their cereal in, because we're using cognitive and physical skills here, and we're maintaining dignity and independence, and we're maintaining choice. Yeah, and that's really simple, is just by changing the environment from I'll serve you to how much can you do yourself? Yeah, before I step in and help. The equipment that people use also is really, really important. Are we serving white food on white plates that make it really hard to see? Yeah. Let's make sure we serve our food on contrasting plates so we're setting our clients up for success. Let's make sure we're offering one course at a time. Yeah. And if we do need to provide assistance, let's do that graded approach. Let's not jump in and feed a person. Let's start with some verbal cues. Let's start with some visual cues. And if that doesn't work, then we can step in and help someone get started, to eat their meal. So we've got to think about changing our approach. Now, words also matter. Okay, words matter a lot. What we say and how we document things is also something we need to consider when we're taking a reablement approach. Go away after day and have a listen to yourself, how you talk about your clients or how your colleagues might talk about your clients. Are you using strength-based language? Yeah. Or are we simply talking about the things that our clients can't do and what we have to do for them? And I'm going to say this example because Kath and I hear it when we're out and about in residential aged care facilities, unfortunately, and it does our head in. Mary needs to be fed, and then I've got to feed bed 11, and I've got to feed that man over there. No, Mary might need some help to get started with lunch. How about that? So let's change our language. Are we discussing the person's goals and what's worked to help support them to achieve their goals? And if you're in a role where you document, look about how you document things. We're very good at documenting what people can't do and what we need to do for them. But do we actually document what they can do? Yeah. So maybe Mary can't do the whole shower independently, but what bits of the shower can she do? And what support do I need to offer? And how do I need to offer that support for her to do that? Yeah. So have a think about what you say and how you document. Now, like I said, reablement is not new. The focus is here because of the strengthened aged care standards, and it's a good focus because we all want to live and age well, and we should want the same for our clients. Now, we might have some preconceived ideas that stop us from taking this approach, and they're around time. It's quicker if I just do it, or it might be habit. We've always done it like this. It might be about risk. You know what? Mary could spill that milk all over the table if she pours it on her cereal, or if she makes a cup of tea, she could burn herself. It could be because of our preconceived ideas of people with cognitive impairment. Once you have a dementia diagnosis, you can't do anything. Yeah. Or it could be about family and client expectations. Oh, Mary, she would rather that we made her own cup of tea. Or, Mary's daughter, we've got to do that for her because that's what they expect. So we need to start small. We need to change and work with our team and our clients and their families. And we have to explain the why. So I encourage you to keep that phrase in mind because people know this phrase. If you don't use it, you lose it. So, Mary, would you like to make your own cup of tea today? Let's focus on helping you, keep those little things, because if you don't do it, you're going to lose it. How do you explain that to your clients? How do you explain that to your families? How do you explain that to your colleagues so that you can take a reablement approach? So in summary, anyone and everyone, every day, in every interaction can have a reablement approach. We just have to change our thinking. There are so many benefits and outcome for older people and us as carers and service teams in taking a reablement approach. It's going to look different for everyone, how and what we do, because it's really based on supporting the person, their goals and their preferences. And, it's about maintaining or improving function and independence. If you don't use it, you lose it. So keep that in mind. So that's the summary on reablement. Now, we love feedback and we love questions. And I haven't even been watching the chat, Kath. So there's been a few things too. So we'll go back and we'll answer some questions. But we do love feedback. So we've got this QR code that you can give us some feedback on, and we'll also send you a link after today's session with the presentation notes and the recording as well. But I will pause and we will answer some questions. So if you've got questions, we can take them now and we'll stop the recording as well.